Self-monitoring is done using a blood glucose meter, also called a glucometer. The fingertip is pricked using a lancing device to collect a drop of blood for analysis by the glucometer. Why is it important to measure your blood glucose levels? It's important to check the impact on your blood glucose of certain treatment components, including diet, physical activity, anti-hyperglycemic medications, insulin, and stress management. It's also important to make the necessary adjustments based off of the results displayed. It also helps build feelings of confidence and independence. This tool helps you achieve and maintain your target blood glucose values. It is an essential component of the treatment of people with diabetes being treated with insulin. For example, it helps to identify, immediately treat, and prevent hypoglycemia and ketoacidosis. People with diabetes may find self-monitoring constraining for several reasons. They need to carry the equipment around. They may also need to prick their finger several times a day. And they may be faced with feelings of frustration when seeing an unexpected result. However, once they begin self-monitoring as recommended and understand the benefits of this approach, they begin to see it more as an ally. To reap the benefits of self-monitoring, a person with diabetes should learn from a healthcare professional. There are theoretical and practical aspects to this education. The following topics would be covered: the criteria for choosing a glucometer, information about the chosen glucometer and the necessary self-monitoring equipment, how to use the glucometer, prevent infection and quality control, personalized information about the timing and frequency of self-monitoring, and to identify which situations to take a blood glucose reading, and how to interpret the results displayed, and especially how to take actions to regulate your blood glucose and to prevent a similar situation from reoccurring. You can purchase a glucometer and the necessary self-monitoring equipment at a pharmacy. This includes lancets, the lancing device, test strips, and tissue. Then you'll learn the procedure to properly measure your blood glucose. First, wash your hands and dry them thoroughly. Insert a test strip into the blood glucose meter. Insert a new lancet into the lancing device. And just twist the top to remove the protection and expose the needle. Replace the top of the lancing device. And then depending on the type of lancing device you have, there'll be different settings, and you'll want to find the setting that works best for you, so the one that will be able to penetrate the skin but won't cause too much discomfort. So for me, this is at number 2. Prep the lancing device and prick the tip of the finger on the side. Massage gently to release a bit more blood. Make contact with the blood and the test strip. And wait a few seconds for the results to be displayed. This time will vary depending on the glucometer you've chosen. Then, read the result and save it in a notebook or on the glucometer. To prevent infection, be sure to wash your hands before each measurement. Be sure to use a new lancet before each test, and dispose of any used lancets and test strips in the biochemical container that could be obtained at pharmacies. When and how often to measure your blood glucose depends on multiple factors: the type of treatment, the risk of hypoglycemia, whether or not your blood glucose targets have been met, and whether you can modify your behavior or medication based on the results. This is why the timing and frequency of blood glucose measurements are based off of each individual's situation. Each blood glucose measurement requires a new test strip. Test strip reimbursement varies by province and may differ based off of your personal insurance program. Coverage may also take into account the recommendations for optimal frequency of blood glucose measurements based off of the results of scientific studies. Note that your private or group insurance may offer different coverage. Here are the recommendations for blood glucose measurements based on different situations. For people with type 1 diabetes or type 2 with 4 insulin injections per day, it is recommended to measure blood glucose at least 4 times per day, either before meals, at bedtime, and, under certain circumstances, 2 hours after meals, or in any other situation with a risk of hypoglycemia. In the second situation, people with type 2 diabetes being treated with an insulin secretagogue should measure their blood sugar when symptoms of hypoglycemia occur or when at high risk of hypoglycemia. In the third situation, people with type 2 diabetes being treated with a single insulin injection per day and anti-hyperglycemic medication should take at least 1 blood glucose measurement per day at different times of the day, such as fasting, before meals, 2 hours after meals, or at bedtime. Finally, people with type 2 diabetes being treated with lifestyle changes or with anti-hyperglycemic medication without risk of hypoglycemia, therefore without insulin secretagogues, should measure their blood glucose once a day in the first 6 months after diagnosis at different times of the day as mentioned in the previous situation. Subsequently, blood glucose measurement is generally not recommended for these individuals unless certain situations arise, such as starting a new medication, contracting a disease that may affect blood glucose control, or not reaching blood glucose targets. In any situation that may result in more frequent blood glucose measurements, don't hesitate to discuss this with your doctor, pharmacist, or other healthcare professional specializing in diabetes treatment. This course has been made possible with the financial support of Hush Diabetes Care, a division of Hoffmann-La Roche Limited.